Hello, these videos are recorded for site supervisors for Vistas at the Northwest Georgia Healthcare Partnership, or who are in partnership with the Georgia Healthcare Partnership. Vista members will have already gone through an orientation. This is to get you started in understanding the rules and regulations of having a Vista member at your site. Those of you who don't know, the Corporation of National Community Service is what houses AmeriCorps. And AmeriCorps itself is kind of like an umbrella. Think of it like that. There are multiple programs within AmeriCorps. We have NCCC, AmeriCorps State National, Vista, and Senior Corps, which we will go over at a later time in a different video. But I'm going to start off with NCCC. NCCC stands for National Civilian Community Corps. These members are aged between 18 and 24, and they serve full-time for 10 months. They go for projects all across the region that they're in. So the southern region would contain like Alabama, Mississippi, Georgia, Florida, but I think they're housed in Mississippi. But yeah, most of their projects revolve around conservation, revitalization, and disaster preparedness.
And AmeriCorps State and National is the largest of the three branches. Members in this branch engage in direct service at nonprofit and government organizations to address critical needs in education, economic security, environmental protection, healthcare, and in some cases, capacity building.
And VISTA, which is the last one we're going to talk about in this slide, VISTA stands for Volunteers in Service to America, which I hope you knew that before watching this VISTA webinar. But VISTA members work for a full year and devote their time to helping individuals and communities essentially implement grassroots solutions designed to alleviate poverty. Think capacity building services. So you're not doing direct service like the other two would be. You would be doing services like fundraising. You can do some grant writing, marketing, essentially your behind the scenes type of work. This slide is to help understand a little bit more about the Northwest Georgia Healthcare Partnership, which we just call NGHP for short. Saying Northwest Georgia Healthcare Partnership every time gets a little tiring.
Yeah.
Our vision at the partnership is to lead our community in creating innovative solutions to critical health issues. And our mission is to improve community health through collaboration, innovative ideas, and positive action. You will see here in our partnership pillars, what we said on the left, each is its own pillar, but then on the right are the programs that fall into that pillar. I'm going to let Caitlin start with Bill Gregory under Healthy Lifestyles because she actually, in one of her Vista years, helped plan and organize Bill Gregory.
Yeah, so Bill Gregory is our 10K, 5K, 2K fun run. It's been, oh gosh, this last year was our 39th year. We have not, the partnership has not organized it, that whole time, just the last 26 years, I believe. So we partner with various people in the community to put it together, like the Bradley Wellness Center. But this run is a 10K, 5K, 2K honoring Dr. Bill Gregory, who died in a bike accident. It's been a while now.
Accident.
Yeah.
It was a while.
So it was renamed the Bill Gregory Healthcare Classic in honor of him. So in this race, we have about 2,000 more participants who come out. So everything that is raised from this race goes towards Northwest Georgia Healthcare Partnership to help us provide a lot of the other programs that you see here under some of the other pillars. So it is one of our biggest fundraisers. And this last year, we actually added an extra race. And it was the 10K adaptive race, which is really cool. And that was really fun to put on. Then I'll talk a little bit about BAM. It's our Bike Around Murray event. This again is another fundraiser. This is a 4-course bike ride. This year it's a Grand Fondo event, and there's 2 time segments, and everything raised from this bike ride comes to NGHP, and we're able to take those funds and help those in our community. You want to talk about
Yeah.
Readers to Leaders?
I'll go over Readers to Leaders. So, Readers to Leaders is an initiative for children in our community from birth to 8 is the main focus. But this initiative is essentially geared to get hands in the books of all children in the Dalton, Whitfield, Gordon County, Murray County communities. Stephanie Hogshead is actually the director of Readers to Leaders here at the Northwest Georgia Healthcare Partnership, and we are working towards creating a culture of literacy here, and that no child should be without literature or books.
And then the downtown Dalton Farmers Market. This is, I believe, our 3rd or 4th year taking this over from another entity here in Dalton. The Farmers Market is every Tuesday and Saturday. And the last few years it has been actually managed by AmeriCorps Vistas. And basically, the coolest thing I love about Farmers Market is that we double food stamps. So as an AmeriCorps Vista, sometimes we actually can utilize food stamps.
Yeah.
So we're able to double our food stamps. So basically what that means is you can swipe your card and receive, let's say, if you swipe for $10, you get $20 in market tokens that you're then able to purchase fresh fruits, vegetables, and baked goods, which is really cool. And we provide that service to everyone in our community who also has SNAP as well, which is really exciting. We just want to make that fresh food available. All of our farmers are local farmers within a 100-mile radius.
We upped it
That's
this
right, we did. We did increase it. So that way we can, just provide more food. And we also, besides just having fruits and vegetables, we also have other craft vendors as well. We also have fresh honey, jams, jellies, that sort of thing. So it's a really fun time, a really awesome place to get to know people in the community in Dalton.
For sure. We're going to move now to the access to healthcare pillar. And again, I'm going to let Caitlin start first because she, again, helped coordinate our Irwin Mitchell Community Health Fair, which she would know more about.
So the Irwin Mitchell Community Health Fair is put on annually, and it's we put it on at the Matt Gaston Community Center, which we actually do a lot of different events there. We partner with them a lot. And basically it is it's a huge health fair with various
I mean, you could get HIV testing.
Yeah.
You can have your blood pressure read. Anything from actual physical testing all the way down to getting referrals for mammograms.
Yeah. Or even, I mean, usually there's a vendor for like cell phones too as well. So it's very much just a diverse, I can't even think of the word right now. But basically it's a huge space to gain resources from our community partners. We actually get together, I guess we'll talk about that later. I was going to talk about collaborative.
We'll tell you about
we'll tell you about that later. But it's a great place for people to actually come get tested if they do not have access to health care services at this point. And yeah, it's a fun time. We have lots of events, raffles as well, and it's a great time to get to know people in the community and get free stuff.
Yeah, a lot of people come for the free stuff.
It's true.
But it gets them in the door and access to those healthy resources that they may or may not already
Yes,
have. So
exactly.
we count it as a win either way.
Yeah.
I'm going to talk a little bit about our Healthy Babies program. The state and national AmeriCorps members are directly involved with the Healthy Babies program. And this program is geared toward getting mothers the prenatal care that they need in order to, of course, have a healthy baby. They can talk, essentially it is held at the health department, and our AmeriCorps state national members provide translation services for these mothers and sign them up for First Foundation books, which provides the infant a book until they are 5 years old after birth. So they do a lot around just ensuring that those mothers have that access to that care, which is something that a lot of people in our community don't quite understand well enough to know that they do need to be getting that care. Moving forward, our NGHP Women's Health, it is directly involved in our Healthy Babies program, But we do also reach out to the community and do classes that are advocates for the women's health. Since we have a large Latino population here in Dalton, Georgia, sometimes we run into people not quite knowing where to go, what resources they can access, or not even just simply not being able to talk to the doctor. A lot of the Women's Health Initiative is connecting people with those resources and making sure that they can go to their doctor's appointments, making sure that they have access to an OBGYN or a gynecologist. Last in this pillar is the NGHP Special Needs Services. This is very, very new. It is directed by Lindsay Coker here at the partnership. She has made huge strides in this program and has really made it her own. She does everything from a summer camp all the way up to coordinating the autism conference that happens in October, which of course I'll tell you a little bit about later. But this program, again, is getting individuals within our community who have special needs, learning disabilities, those resources, understanding exactly what their program and what resources they have access to, because especially children, school children, they may not, their parents may or may not know what to do. I mean, no one is prepared to have a baby, let alone someone who has special needs and just requires that extra little bit of care. Moving down, we have disease management, and the first runner here is our Promotores de Salud program. You got to excuse my butchering of that name. I can't say it any better than that. But think community health worker when you see that. Almost like a social worker. Our promotores, they go out into the community and actively recruit individuals who can benefit from all these programs you see here. They do help manage the free mammogram service that we have at the partnership through Komen. They coordinate our wellness classes. They provide translation services. Cooking Matters is a class that they teach locally. Different partnerships and different places actually house the class, but the class is geared to teach people how to eat and live on a budget, very small budget.
Yep.
So again, that fighting poverty aspect, very prevalent throughout our pillars. And then our cancer support group is the only Spanish-speaking cancer support group in North Georgia that we know of. They essentially meet people who the promotores know may or may not have cancer. It's a support system specifically for people who speak Spanish, which is something you may or may not have in a town that is predominantly English speaking. And lastly, we have our senior living pillar. Although right now we are not doing a lot with our senior living pillar, its main focus is to get people ready for that next stage of life, having that advanced directive, making sure that your family members know what you want. We keep a running senior directory full of doctors' phone numbers, places to go get your eyes checked, places to get your hearing checked. It's just essentially like a big phone book geared towards senior living. And then educational seminars, which really do focus around that advanced directive initiative, making sure that people understand that your family may or may not know what exactly it is you want, and if you write it down for them, it's going to be the best. This here is our organizational layout, and I know that it may be hard to see, but at the top, we have our executive director, Gregory Dent. You will meet him, do not worry. Below, we have our executive assistant, Holly Thompson. Below that, I'm going to start over here at the left. We have our child health advocate, Raina Torres. Raina focuses on getting individuals who are children, of course, signed up for the resources that are available to them. So a lot of parents may or may not know about Peach Care or the Affordable Care Act. She is that navigator, making sure that they know how to sign up and everything. And then we're moving on to Readers to Leaders. Like I said before, Stephanie Hogshead is the director of that. The AmeriCorps Vista and State National programs. I'm the director of grants management, but I also direct both of those programs. Moving along to our Promotora side, Director of Patient Services and Senior Promotores de Salud is Teresa Mendez. Currently, the actual, below her we have Elisa Cervantes, and then Maria Pintor. Maria Pintor is currently the person who coordinates all the Promotor's activities, and then all of that gets reported up to Teresa. Moving along towards the right, we have Jody Nation, which is the coolest name ever. And he is the nurse practitioner at the Deo Clinic. The Deo Clinic is a free reduced clinic for people who are uninsured. And then that we just have a partnership with. And then very lastly, we have our Director of Special Needs Services, which is Lindsay Coker. And I've already talked a little bit about this slide, we're going to talk a little bit about Project Vibrant Families, which is the AmeriCorps Vista project. AmeriCorps Vista members in this project will build capacity for the organization by engaging in volunteer recruitment and management, community outreach, partnership development, fund development, and marketing and public relations initiatives. Vista members will have the opportunity to create outreach material and presentations, participate in public speaking, social media marketing, and attend community meetings and assist with program development and evaluation. Members will increase the visibility of the organization to which they are assigned, and each VISTA will engage in community education related to issues impacting women and children living in some sort of poverty. This could mean students, this could mean actual healthcare patients, it can mean a variety of things, but overall, VISTA is designed to help alleviate poverty. We have had the Project Vibrant Families here at the Northwest Georgia Healthcare Partnership for about 3 years, and we are currently trying to expand the AmeriCorps program at NGHP. Currently, we have an NCCC team coming to the partnership, and they're going to help with the Roan Resource Center. And over the next few years, we are hoping to actually bring on senior corps to either be foster grandparents to children in the area or work with the Deo Clinic in providing health services. So here we're going to go into a little bit about some of your duties as a site supervisor. These two are the most documentation I'd say you'd see. The other type of documentation will be your report, which will be sent to you, and we'll go over that in a little bit later, but your timesheets and your member service log. So timesheets are due bi-weekly, the Monday after the pay period ends for the VISTA member. Timesheets must be signed and delivered via email to, or by you to the VISTA leader, and please CC the program director. The reason this must be delivered by you and not the VISTA is to prevent fraud. Anything that requires your signature needs to be emailed by you. The MSL, the member service log documents, are due monthly by the 5th of every month. The attendance controller, which keeps track of vacation and sick days, and the achievement log, which keeps track of daily activities. So they will be filling those out, handing, preferably already signed, handing them to you, getting them signed, and you again will be emailing them to the VISTA leader and CCing the program director. And again, this is just to ensure that fraud does not happen. So this is some information about what we at NGHP, the project sponsor, are responsible for in terms of this grant and this program. So we are the fiscal agent. Of course, the money from the grant goes towards our operating costs and not our operating costs, but some of our administrative fees and, of course, the members' living stipend. We must comply with our MOU from CNCS or the Georgia Commission. We are responsible for placement of members. We are responsible for assisting members with their service plans or their VAD or their description of service, things like that. We are mostly responsible for recruitment, screening, interviewing, and selection of members, but we do advise that you help in that process. It makes getting a more developed member possible. And of course the transfer of members. So in the event that something happens at the site, we would need to transfer a member out of your site into potentially another site. so they can continue on with their service. This is a list of the project host site's responsibilities. Of course, you were supposed to provide a site supervisor, and so if you're watching this, you most likely are the site supervisor. You will also be helping with recruitment, screening, interviewing, and submission of members to the project sponsor. Again, this is to help with the process of recruitment. If you know someone that you really would love to have them serve at your site, it's just a lot easier for us to go through that avenue than to find someone completely new, which, I think that's understandable. Submit a work plan prior to the member's start date. So the work plan could either be the VAD or a description of services that you are intending for the member to provide. Submit a proposed budget. The budget essentially coordinates along with the administrative fee. So what the cost of that, the cost of the computer, the phone, what have you, and providing one-on-one training at the beginning of service. So I will be giving the member an orientation when they very first start, but hopefully you have planned something that the member can attend their very first either 1 or 2 days, just so they aren't left feeling lost. Budget for host sites. So this is what you should consider when you're making your budget. The member mileage, that is up to you to reimburse. It is based upon your policy. So if you're having them drive around for you, you would need to reimburse their mileage. Reimbursement of expenses, same thing. If you're having them purchase items for a program, you would need to reimburse them for that expense. Any professional development you're wanting to provide for them, so trainings, conferences, they can be free, low-cost trainings, but if they're not, keeping that in mind for your budget. The participation fee, which is currently $2,500 per member. This fee is associated with the cost of us having a member and all the back-end paperwork that we have to do, staff time required to do that, and of course, member trainings that we host throughout the year. And then any in-kind assistance should be noted in your budget. This is a list of things that should be covered during your one-on-one site orientation. So the use of the approved service plan, so a VAD or the description of service, at least 40 hours of work per week. We track their personal sick days, but while they're at your site, they should be still working at least 40 hours per week around your service site schedule. You should be scheduling regular meetings with the member, either bi-weekly or monthly, to check in on them, preferably at least, honestly, weekly at first. Then you can go to bi-weekly, then monthly. That's okay, but at first you don't want to leave them just sitting in a desk by themselves, not knowing what to do or what you're expecting. You should be providing adequate working space, material supplies, and access to a phone and computer. This is part of the MOU, but without these, they cannot perform adequate service. So please ensure that they have that. I do conduct site visits to make sure that those are in place. Ensure that the member is reimbursed. Make sure the V81 form is filled out. They fill this out on their AmeriCorps portal. This is what gives us the ability to reimburse them for their expenses that they incur throughout the year. You must allow them to participate in scheduled professional development and training opportunities that NGHP hosts or that you will provide for them. And talk to them a little bit about this and the fact that if you're going to go ahead and plan something, let them know about it right now. You must allow the member to participate in NGHP's events and service days for CNCS. They are listed here on the PowerPoint, and of course any others that are not noted in the PowerPoint will be told to the member well far in advance and should be told to you thusly. And of course provide updates quarterly, which we'll get into that in a little bit, but These reports are very simple. They're not going to be anything that's going to take hours of your time. It's just an update on how you believe the project is going, any successes, any challenges you've faced, and reporting any number of training hours that you've provided for them. And of course, during your one-on-one site orientation, you should be going over items such as emergency evacuation plans, where the typical hours of service at your site, so what your typical schedule looks like, which sometimes can vary, we understand that, but like a typical hours. Any weekends you're going to be expecting them to work. Give them tasks that they can go ahead and start working on. Don't just leave them just sitting. That should never be what's happening. And of course, be going over any rules and regulations that your own site has that go above and beyond what NGHP has already instructed them to do. Here I've listed our quarterly meetings. All the site supervisors are required to attend these meetings if possible. I understand things do come up, but they're listed here below. These quarterly meetings also align with the reporting dates. So every time our report's due, we are having a meeting. And it's just a check-in throughout the year. These meetings will not be long, less than an hour if that. But they should be adhered to, just because we need to be checking in and making sure that not only is the Vista being taken care of, but you guys are being taken care of as part of this arrangement. These is a list of our joint responsibilities. So of course, the health and safety of the AmeriCorps member should always be our #1 responsibility. And health is not just physical well-being, but mental well-being as well. Do not expect them to work, say, 80 hours a week. Yes, they can work 80 hours a week under the contract, but that is morally unethical. We both have to ensure that AmeriCorps members are not related by blood or marriage to host site staff, sponsor staff, or related staff at CNCS. So that would be our program director at CNCS. We are to not have neither of us have the ability to dismiss a member from service. We can request that CNCS dismiss a member, and we no longer want to have them with us. But CNCS holds sole authority of dismissing a member or not. Document any performance or behavior issues and report them immediately back to NGHP. The grievance procedures are listed in the member handbook for reference, but that is something that should be happening even if it's a small instance of behavior issues or grievance. Should all be written and signed and dated. And please be present for the members' mid and in-year evaluations. I will go ahead and at the very beginning of their service, when they start, schedule these meetings and send you a calendar invite. So please be present. I would like to have your input on their evaluation and have us all in the same room. This is the non-discrimination policy for AmeriCorps members in regards to NGHP. So, of course, no person with responsibilities in the orientation of the project shall discriminate against any AmeriCorps member in regards to their race, religion, color, national origin, sex, sexual orientation, age, disability, political affiliation, marital or paternal status, or military service. I just read that to, again, reiterate that we should not be, of course, discriminating against any members. This is just here for reference in the future. This is the sexual harassment policy. It is detailed in the MOU and the member handbook. It goes over discrimination based on sex. We are both responsible for violations of the prohibition against sexual harassment and for taking corrective action if it happens. It goes over quid pro quo in the MOU and the member handbook, and then any unwelcome sexual advances. None of this, of course, is allowed. We should all be on the lookout for this, and if it's happening at your site, The member is instructed to let us know immediately, and of course you are instructed to let us know immediately so we can handle the situation. These next couple slides are going to be talking a little bit about the prohibited activities. And while charging time to the AmeriCorps program, accumulating service or training hours, or otherwise performing activities supported by the AmeriCorps program, or CNCS, AmeriCorps members and staff may not engage in the following activities. You cannot engage in them directly or indirectly by recruiting, training, or managing others, but also it says in here that you can exercise your right as a free citizen to do these off service hours or off the clock, and just to not wear the AmeriCorps logo or be affiliated while doing so. We're going to start with attempting to influence registration, organizing or engaging in protests, petitions, boycotts, or strikes, assisting, promoting, or deterring union organizing, impairing existing contracts for services or collective bargaining agreements, engaging in partisan political activities or other activities designed to influence the outcome of an election or to any public office, participation in or endorsing events or activities that are likely to include advocacy for or against political parties, platforms, candidates, proposed legislation, or elected officials, engaging in religious instruction, conducting worship services, providing instruction as part of a program that includes mandatory religious instruction or worship, conducting or operating facilities devoted to religious instruction or worship, maintaining facilities primarily or inherently devoted to religious instruction or worship, or engaging in any form of religious proselytization. They are not allowed to provide direct benefit to a business organized for profit, a labor union, a partisan political organization, a nonprofit that fails to comply with the 501c, an organization engaged in the religious activities described in paragraph 3G above. They are not allowed to convoke voter registration drive or use CNCS funds to conduct a voter registration drive. They are not allowed to provide abortion services or referrals for receipt of such services and any other such activities that CNCS may prohibit. All of you should have received a prohibited activity sheet with the things I just read on them. And all of the prohibited activities should be hanging in your office where the member is serving. They should be displayed for all staff to see and everybody who walks by. Because this doesn't just involve the site supervisor and the VISTA member themselves. This involves the entire organization as a whole, and no one should be asking the AmeriCorps member to do any of these activities. The project host site cannot carry out projects resulting in identification with partisan or nonpartisan political activities. They cannot assign a member that would displace a current employee. They cannot approve involvement of a member in and from of demonstration, except compensation from beneficiaries for the service of the member. The second to last one, essentially in the form of demonstration. So they should not be involved in demonstrating for anything, really. Anything in this MOU, this is just to go over and clarify, it can be amended at any time in agreement with writing from the project host site and the project sponsor. So just keep that in mind. Termination. In GHP, we use the parameters of this MOU to determine continued eligibility for a project host site. We've only had to let one service site go ever, and it was for the treatment of a VISTA member. So again, that mental health component. I do throw that in there now because that is just as important as their physical health. Failure to comply with anything written in the MOU will result in corrective action and can include the removal of a member. We will provide a 14-day termination notice unless it is an immediate need, and then we will immediately remove them. And the need could be emergency. Any termination of the MOU between NGHP and the sponsor site results in the termination of all provisions of the MOU. Thank you guys for listening to this video. I want to thank you for hosting an AmeriCorps member at your site, and we're excited to get this year started, and hopefully you guys are just as excited as we are.